You're inspired by the Health Minister. You're inspired by the Health Minister.
Indeed I was.
Yeah. All right, thank you very much, everyone, and good morning. Thanks for joining the Education Minister, the member for Joondalup, Emily Hamilton, and myself here today. First, the latest on COVID-19. Obviously, one of the biggest questions on parents' minds right now is what happens when schools go back. What does the school day look like? What steps have been taken to keep our children safe? Well, the best thing to do is get vaccinated. The government and the Department of Education have done an amazing amount of work to ensure our classrooms and schools are as safe as they can be going forward. I'll start by providing a COVID update. Up till 8 p.m. last night, WA Health has recorded 15 new local cases, plus 3 travel-related cases in quarantine. 2 people are now in hospital in Western Australia with COVID, one of whom is in intensive care. Yesterday, 9,831 tests were conducted across public and private clinics. That is nearly a doubling of the previous day's efforts, which is a great sign, and I encourage people to go and get tested. But with 15 additional local cases, 2 are unlinked. We need more West Australians to go forward and get tested. I cannot stress this enough. The quicker we find any potential cases in the community, the slower the spread of the Omicron variant will be. Please come forward and get tested if you feel unwell, if you have symptoms, and especially if you have been to exposure sites as reported publicly. The symptoms include, but are not limited to, a fever of over 37.5 degrees Celsius, a cough, shortness of breath, a sore throat, runny nose, acute loss of smell or taste. But really, if you're unwell or if you have any cold or flu-like symptoms, we need you to come forward today and get tested. Testing and vaccination is the only way to limit the spread of the Omicron variant. Wait times at the moment at our PCR clinics, which is the most accurate way of testing, are short. We need as many people as possible to get tested right away. With regard to Western Australia's vaccination efforts, we now have over 12, 96.7% first dose, 89.5% double dose, and 28% third dose. We're definitely on the right track in getting people vaccinated. As of yesterday, over 52,000 Western Australians aged between 5 and 11 have received at least 1 dose. More than 13,000 appointments have been booked between now and February 6, and nearly 7,000 appointments are still available over the same time period. I encourage all parents to book an appointment as soon as possible for their family to ensure they have the best level of protection. Today, we're happy to walk everyone through Western Australia's Safe Return to School plan. While Minister Ellery will go into full details, there's a few things that are important to highlight. In preparation for this plan, all 900 public education facilities in Western Australia have been inspected to check the ventilation of each and every classroom to determine what is required for each and every classroom. Over 12,000 air purifiers are being provided to schools statewide for the classrooms that require them. CO2 monitors will also be provided where required to monitor CO2 levels. There will be enhanced cleaning services across the state, contingency plans for remote learning for students that are required to isolate, not to mention mask wearing in line with the current measures in Perth, Peel and the Southwest, and proof of vaccination requirements for staff and regular visitors to schools. All of this contributes to ensure schools will be as safe as possible for students. It also allows for a degree of flexibility with the ability to hold classes in alternative settings if needed, and the ability to ramp up, if required, with expanded mask wearing requirements for younger students, if the Chief Health Officer advises it. We know how important it is for our schools to remain open, so our children receive the quality education they deserve and society continues to function smoothly. We've taken every practicable step to ensure schools are as safe as possible in the current environment for both staff and students, but we retain the capacity to boost measures in the event of a large-scale outbreak. We want students, parents and staff to feel confident when class resumes next week. But the best thing parents can do in the coming days is to make a booking for their children to get vaccinated. I'll now hand over to the Education Minister before taking questions.
Thanks very much, Premier. Thank you for all being here today. Thank you to Joondalup Primary School for hosting us. Can I begin by thanking all of the staff who have worked to get schools ready for Term 1. We are looking forward to welcoming students and staff back to schools across Western Australia next week. We are returning to school in a very different set of circumstances to the rest of Australia, who have high numbers of community cases. I checked the numbers yesterday, for example. New South Wales recorded 15,000 new cases, Victoria 11,000 new cases, Queensland 10,000 new cases, and South Australian 2,000 new cases. You've heard from the Premier today, 18 new cases overnight in Western Australia. So those case numbers are not the same as they are here in Western Australia. While we are announcing additional measures today, these are the new baseline measures that can be scaled up when our case numbers increase. Keeping our schools open and providing face-to-face learning to students is important to students' learning, their social and emotional development, their overall well-being, and their physical and mental health. Schools will be the first to open and the last to close. Face-to-face learning is our priority. I want to reassure parents and the wider community that schools are prepared and equipped so that students will get the highest quality education in the safest possible way. We want students back at school and to have as normal a school year as possible. So today we are announcing additional measures are in place to help them keep their families and school staff safe. We've worked hard to ensure that schools are staffed with the excellent teachers and support staff that they need. As of yesterday, 97.5% of teachers have uploaded their vaccine information as required as part of the mandate ahead of teachers returning from leave this coming Thursday. For external providers providing services on school sites, they will also need to show proof of vaccination. The Department of Education has additional support available to assist schools with staffing for day one and throughout the term as required, including flying squads, a significant pool of about 5,000 fully vaccinated casual teachers, and around 450 non-school-based but registered teachers. These are, for example, people in head office who have responded positively that they are willing and able to teach. The department has been working directly with schools to assist them manage vacancies and to fill those for day one. Last year, the AHPPC, which is the body of all Chief Health Officers across Australia, recommended that schools develop ventilation plans. As part of the planning for the start of Term 1, all 900 public school facilities in WA have been inspected to check the ventilation of every classroom. There is a specific protocol in place for every classroom in every public school. The protocol is based on natural ventilation through the use of fresh air and opening windows and doors, mechanical ventilation, air conditioners and evaporative coolers that are turned on half an hour before school starts and turned off 1 hour after it finishes, that provide fresh air and can adequately ventilate rooms, and air purifiers that are fitted with high efficiency particulate air filters, that's HEPA filters, in those classrooms where the combination of natural and mechanical ventilation has been assessed as not being satisfactory. 12,000 air purifiers fitted with the HEPA filters are being provided to public schools statewide, where they are required for adequate ventilation. Delivery of these began last week and will be complete before Monday. Our geography means that desirability of having windows and doors open will differ from area to area as the weather changes. So those protocols are going to change as well over the course of the seasons. Every classroom has a sticker on the door and a hard copy plan is in every school, alerting staff as to what steps to take in that classroom. So if you can imagine a school that may have been added to over the years, there will be different arrangements, different air conditioners, different evaporative coolers across even the same site. And so this is why the protocol is for every classroom in every public school. Developing that, so conducting the audit, developing the protocol has been a huge piece of work since November last year. And I want to thank the staff in the Departments of Education and Finance for that work. A further 1,500 carbon dioxide monitors are being provided to schools to monitor classroom CO2 levels as needed. CO2 monitors assist to assess whether the ventilation is satisfactory. As always, we will continue to follow the advice of the Chief Health Officer and will take the necessary steps to reduce risk, to prevent transmission and respond appropriately to the cases and their impacts on schools and student learning. Contingency plans are in place to minimise disruption to student learning in the event it is required, including hard copy learning packages, access to online learning resources, and arrangements to temporarily replace teachers and other school staff if they are required to isolate due to COVID-19. All parents can come on site for drop-off, pick-up, meetings with staff, assemblies and sports carnivals. But those parents who regularly volunteer, that is, come into a school to do volunteer-type work more than once a week, will be required to show evidence of their vaccination status. Other measures to continue to reduce the risk includes enhancing cleaning, providing additional cleaning supplies, supplying hand sanitisers and masks for those who either lose theirs or they break during the course of the day. Currently, masks are required for students in Year 7 and above in Perth, Peel and the South West. However, based on advice from the Chief Health Officer, once a high caseload environment is reached, masks will become mandatory for students in Year 3 and above. With WA's case numbers currently nowhere near those faced by the other states, for the first week back at school, the additional arrangements in place for day one here are our new baseline. Moving forward, we will need to remain vigilant and be responsive in the event of increased case numbers in the community. There are other measures being planned now for when those case numbers increase, and we will make those public over the course of the next week or so. This year will no doubt present challenges, but I am confident that schools are prepared to adapt and take on any of the challenges that we face. We are all in this together, and I encourage parents to support their schools, keep your children home if they are unwell, and understand if learning programs are disrupted from time to time if staff members are unwell. The best protection for your child is vaccination. There are appointments available now. Please book your child in. Thanks very much. I think we're doing Premier's questions first. Or? Me? Fine. Okay.
Can you walk through what happens if a teacher tests positive and if a child tests positive?
Sure. So the arrangements that are in place now will apply. That is contact tracing. The Chief Health Officer may order part or all of the school to close while that contact tracing is carried out, and close contacts will be notified and required to test and to stay in quarantine until they get an appropriate test result, a negative test back. Now those arrangements are what are in place now, and assuming the numbers stay where they are next week, that's what will be in place next week. We are considering further measures. State Disaster Council is meeting on Friday about the arrangements that we need to put in place for when case numbers rise. I want to reiterate, New South Wales, 15,000 new cases, Western Australia, 18. So we are in a different setting. We know that we need to prepare. That work is well advanced. There are other measures, for example, that are being worked on. Cohorting, for example, which is where you keep groups of students separate so that they only mix, for example, in their own year group. That's a considerable exercise in logistics, particularly in large secondary schools where you've got to adjust timetabling and the like. But that is being worked on now. All of those additional measures will be considered and announced in due course. But I reiterate, we have lifted our baseline because we have different settings to the rest of the country. We will lift again and we'll announce those measures over the course of the next week or so.
So just to confirm, if a child tests positive at school, that child will have to isolate for 14 days. His entire family, so her entire family will also have to isolate for 14 days. And the rest of the children in that classroom will also have to isolate for 14 days, as will the teacher.
That's the current settings, but the Chief Health Officer might also decide, depending on what happened, so depending on where that child went during the course of the school day, where that teacher went during the course of the school day. The current settings most likely, assuming all things are equal, if that was to happen on day one, the Chief Health Officer would most likely close all of the school or part of the school, depending on the particular circumstances. If you cast your mind back to the outbreak of Delta that we had in June, there was an external therapy provider who visited 3 schools and then tested positive. The Chief Health Officer ordered those 3 schools be closed while they identified the close contacts and the casual contacts. Those people tested and quarantined accordingly. That is the exact same settings that we're in now.
And you haven't mentioned rapid antigen testing. What role will that play when case numbers increase in Western Australia?
Yeah, so there is an interesting approach across Australia. There is a spectrum, if you like, of how different jurisdictions where there are high case numbers are using RATs, and that's from providing them when there's an outbreak to the staff who are affected, to a pilot that's been done in New South Wales and Victoria over the course of a month with twice weekly RAT tests for staff and students. State Disaster Council will consider all of that on Friday and we'll make announcements in due course. I make the point again, our case numbers right now are not the same as those schools going back next week in the other jurisdictions where they have tens of thousands of new cases.
What about deep cleaning of classrooms if a child tests positive? And then if that happened in the regions or a remote area, what's the plan for deep cleaning those classrooms?
It's the same as it was for the last 2 years. That is, we have flying squads available if we need to execute those plans. And the deep cleaning, that's the same setting that we've been in for the last 2 years. Deep clean will be done, and we have flying squads available to do that wherever it's required.
It sounds like there are a lot of teachers in contingency. Can you guarantee that every West Australian class will have a teacher in front of it throughout this whole pandemic period?
Every effort is being made to manage filling all of the vacancies for day one, and we will have other arrangements in place in addition to those pools during the course of the year. But I made the point in my comments. I ask for parents' patience during the course of the next 6 months. It may be the case from time to time. Arrangements need to be made so that students will not necessarily have the same teacher in front of them that they've been used to for the first term, for example. But we have put all of measures in place. The department centrally is literally case managing those schools that are having difficulty confirming that they can fill all vacancies. And we have flying squads, which we have, I have to say, every year. We have flying squads. Some of those have already been allocated to schools. It's also worth bearing in mind, teachers don't return to work formally until Thursday. So we won't have a final sense until Thursday, and then the requirement to upload vaccination status is the 31st. So we are literally going to be checking minute by minute up until school opens on the 31st. But all signs are high proportion of teachers who understand the importance of being vaccinated uploading their vaccination status.
And that 2.5% that happens, what does that equate to in an actual number?
I don't have a number, and frankly the number today would be different to what the number is tomorrow and different to the day after, because every single day more teachers are uploading and they are not required to complete that until Monday the 31st.
It would be around 1,000 though, at least.
It would be less than that, and I don't have the number. But frankly, even if I gave you a number today, it would be different. They are not required to upload status until the 31st of January.
Just on the CO2 measuring devices, I think you said there were 1,500
Yeah.
that have gone to schools. So if there's 900 schools, that's
Yeah.
one or two per school.
So the way that they work, they're not linked to COVID. They're not measuring anything related to COVID. What they measure is how satisfactory or otherwise the ventilation is in a particular room. So the way that they will be distributed is most schools will get one. Some of the larger schools will get two. It's not something that needs to be done every day. Schools will make their own judgments based on the physical layout of each school, of how often they think they need to use those to measure ventilation, right? So that tells them, do they need to consider opening more windows or whatever? I also make the point that there is a process of rectification. So where windows can't be opened, for example, there's a process in place now to go around and fix all of those. But certainly every school, every classroom where ventilation through existing window and door arrangements has been deemed not satisfactory has a HEPA filter in an air purifier.
The last one for me, I believe at the start of the pandemic, parents could choose not to send their kids to school for a period of time and not get penalised. Is that still the case, or must they send their kids to school?
Attendance at school is compulsory, and in the current settings in Western Australia, and given the additional baseline measures we've announced today, there is no reason for parents to worry and not to send their children back to school. You might recall schools in Western Australia remained open. There was a 3-day period at the end, I think, of term 1 in 2020 when we encouraged parents, if they could, to keep their children at home. But during the course of that term 1, where we had increasing case numbers, no parent was penalised if they made a decision not to send their child to school. And I imagine that we will adopt the same approach. But I reiterate to parents that the measures that are in place are appropriate for the case numbers that we have now in Western Australia. It is by the tens of thousands different to what is happening in other jurisdictions in Australia.
What about childminding centres, unvaccinated children, and what's the protocols for them?
Yes, I'm sorry, I'm not the Minister for that regulates childcare centres, but the same arrangements in terms of testing positive, notification of everybody else, and then the Chief Health Officer making decisions, like happened yesterday, Thornley, the childcare centre in Thornley. So the same arrangements would apply. And I'm sorry, I'm not that relevant minister, so I can't go into any more detail. I just don't know it.
Right, but you've got within the public school system, you've got, I think,
Kindies?
preschool and kindies.
Yes.
The same. A lot of them attached to primary school.
Yes.
The same
So,
applies to them.
For kindy and kindies that are on school sites, yes, absolutely. Public kindies are covered by the same arrangements that I've just described, including that the classrooms have been assessed for ventilation.
How many cases in the community does it have to be before year 3s and up wear masks?
We'll wait for advice on the Chief Health Officer on that. He has indicated that he thinks that's the wisest thing to do when we get a high caseload. All of those sorts of matters will be considered by the State Disaster Council, which is meeting on Friday, and we will announce additional measures over the next week or so.
So the Chief Health Officer didn't say what he considers a high caseload to be?
He's not. Thanks very much.
Well done. Thanks very much, everyone. Any questions for me?
Premier, does it also this notion of families with kids out of the state right now being able to come home before February 5 to begin their quarantine? Can you tell us where that's at?
The expectation is tomorrow we'll allow for applications for those people who are returning West Australians with children to be able to come back so their kids can start quarantine and do the 2-week quarantine period so that they can get most of that out of the road before, or some of it out of the road before school starts. Some of I understand, a lot of them thought they were coming back after February 5, but plans change without quarantine, but plans have changed. So we're going to allow for that group of people to come back and be able to start their quarantine as soon as possible.
What was the thinking there? Is it just make it more convenient for them? I mean, obviously they've been away, some of them, for a long period of time and anxious about getting home.
Well, education's important, so we wanted to make sure that they could start their quarantine as soon as possible, so that they could get to school as soon as possible.
Is that the only category of people that will be able to apply for exemptions from tomorrow? Because I believe nobody can apply for a G2G pass at the moment.
Oh, that's all being worked through, and this has happened many times. Over the course of the last 2 years, the G2G pass system has been cancelled based upon borders and then reopened, and that's an unfortunate reality of what we've had to do. But there may be further refinements. We just work these things through. We've refined borders, we've refined arrangements, we've had to change things based upon circumstances many times over the course of the last 2 years.
How long do you expect that to be the case, though? People are in limbo, not able to apply for any kind of exemption?
Well, as you know, we expect, so with families, we expect the G2G pass system arrangement will be up and operational tomorrow, more broadly, hopefully tomorrow as well. In terms of people coming home, I think there's a lot of misunderstanding out there. West Australians can return home on the basis that they do 2 weeks quarantine, and that more broadly will kick in from February 5.
What about the appeal from the ANF to get some of those staff, nursing staff that have already been recruited, to get them in before February 5? You're making allowances now for families with children. They're vital workers. Will they be allowed in?
Yeah, we announced that the other day, that we'd be doing that with nursing staff and medical staff, so doctors and nurses. We announced that the other day with a truncated quarantine period.
What about the flights, though? I mean, those parents that you're talking about that might be stuck out of the state, I mean, really, there aren't flights. Because, of course, we changed the transition plan and Qantas pulled the pin.
Yeah, nothing's easy over this period. What we're trying to do is save lives and save jobs at the same time, whilst getting our 3rd dose vaccination rate up and our children's vaccination rate up, and not introducing thousands of new cases whilst the eastern states is peaking. That's the rationale behind it. I understand that it's not easy for people. We're just trying to do our best in difficult circumstances.
Can you provide any more information about what will be considered a high caseload? And also, once we get to that point, what the isolation rules will change to?
Look, we'll take further advice from the Chief Health Officer on all these things. So on Friday, we'll have a State Disaster Council meeting that will resolve some of the close contact isolation quarantine arrangements going forward. As you know, we had 15 local cases today, of whom, as far as I'm aware, only 2 are unlinked. So most of them are we're able to link quarantine. We understand where they've been. Contact tracing is still working in Western Australia. In other states it's not working. So we're basically the only place in Australia that contact tracing is still working. So those, that's a very, by national standards, a very low caseload. When we get to higher caseloads, that will be dependent upon advice.
Is the Kemerton mine site one of the places that is now in play in terms of one of those cases?
Look, there were 6 cases in Bunbury that were linked as a family, I'm advised, and there was 1 unlinked case in Bunbury. So where that person worked, I'm unaware of. I can probably try to get you further details later.
You understood one of the receptionists at the Kemerton mine site?
I'll try and get you further details.
Do you know
Can
the
people
vaccination
expect that?
status of the 61-year-old who was in ICU?
I'm advised that this person was double dose vaccinated. They'd come from overseas. As you know, even if you're vaccinated, you can get unwell. But all of the evidence from around the world, and certainly from the eastern states, if you're not vaccinated, your chance of getting very sick and dying is multiples of those people who are vaccinated.
Can people expect that regular closures of schools will be tolerated, or if that does eventuate, will you rush to change the rules?
So that depends upon high caseloads. So our circumstance is very different to the eastern states. As the Minister outlined, tens of thousands of cases over there each day. I saw yesterday there was 26 people died in New South Wales and 26 people died in Victoria. I don't know how many have died in Queensland and the other states, but no doubt there'll be some, sadly. So their circumstance is very, very different to ours. So our rules around schools are based upon the circumstances we're currently in, where there is very few cases in the community in Western Australia. If you go to lesser periods of quarantine and you go to lesser periods of isolation and all of those sorts of things, what you do is you potentially enhance the spread of the virus. And you only get to that point when you need to. You only do that when you need to. So that's why our rules at this point in time are still, as the Minister outlined, but as you get to higher caseloads and you then have people furloughing from work and you have problems with schools and hospitals and businesses operating, that's when you bring in the new rules and new laws. But if you do it too early, you enhance the spread of the virus. So it's a very, very delicate balancing act to get the measures right, and that's what we're attempting to do, and we'll work out the rules on Friday. Now, they may not kick in immediately, in fact they won't, because obviously we're at very low caseloads at this point in time.
What does a high caseload mean in WA?
Sorry, James?
What does a high caseload mean in WA?
Yeah, as I said, that will depend upon the advice of the Chief Health Officer. So we'll work out those sorts of things, but you don't want to be too prescriptive at any point in time because circumstances change. As you've seen over the course of the last 2 years, we've had to adopt measures based upon circumstances. So they're all things we'll discuss in the future, but no doubt on Friday, but no doubt we'll work out those measures based upon health advice.
What would you say to people who are incredulous to the fact that we have a Skyworks impossible 200,000 people, given the way we treated it before when we have community spread going on all over the place?
So, look, we took health advice on that yesterday. The advice was it could go ahead based upon the fact that people would be mask wearing in that environment. It's an outside environment. People are mask wearing. I'd expect people would be careful about their arrangements. There's a range of events on Australia Day. There's citizenship ceremonies. There's other events in which lots of people are in proximity. But this event is different in that we're requiring mask wearing outside, and I just urge people to use common sense in that environment.
It was originally suggested that unvaccinated people would not be able to attend that. That's been apparently let go. Is that because it was too hard to enforce?
We never suggested that. That was the City of Perth.
So very quickly on when it comes to aged care and those elderly people who have boosters, any specific plans for them because they are some of the views I went through now saying that they're most at risk?
Well, older people are most at risk. That's reality. And so, you know, a lot of older people are dying in the eastern states. And we need to make sure that their health is as protected as anyone else. And so aged care booster shots is actually the responsibility of the Commonwealth, but we are working cooperatively with the Commonwealth to roll out the boosters as quickly as possible in aged care homes.
Is your goal actually to avoid high caseloads or just to slow the time it takes us to get there?
So I think on Thursday and Friday of last week, I explained what the rationale was, which is all of the advice says if you get to higher levels of third doses, you reduce the transmissibility of the virus and you actually increase the protection of the people who get third doses against the Omicron strain. And so, therefore, by getting to higher levels of third dose before you have widespread community infections, you're going to save lots of lives. And what we're trying to do here is save people's lives, save hopefully hundreds of people's lives by what we're doing. Now, at the same time, you also save jobs. And we've seen the evidence over East. The evidence over East is that when they get to those very high caseloads, especially with low vaccination levels of third dose, there's massive dislocation to the economy. And that's happened in New South Wales and Victoria. Their credit card spending data is through the floor. Their movements, you know, in business precincts is through the floor. Now, what we're trying to do is save people's lives, at the same time save people's jobs. Now, we know there is going to be community spread here, but it's better if you're going to have community spread to have high levels of third doses, to have more children vaccinated at the same time, and not to introduce thousands of cases on the first day. Now, the chances are, if we had as we were originally planning with the Delta outbreak, an opening on February 5, we would have had hundreds, if not thousands, of cases just seeded into the community on the first day or days, and therefore we would have had mass spread of the virus right up front, and at the same time we had low levels of third doses. So the rationale is very clear for what we're doing. It's based upon medical advice. It's designed to save lives, particularly the lives of older West Australians who are most vulnerable. Now, I actually care about older West Australians. I don't want to see older West Australians die in large numbers. I want to make sure we do our best to give them the chance to get their third dose. At this point in time, a lot of people actually aren't eligible for their third dose. They haven't actually had the time frame between the second and third dose expire, so they can get the third dose. And then, of course, our clinics are very full. Our doctors and nurses are very full. There's still people getting their first and second doses, by the way, and there's children still getting their doses. So we're just trying to ensure we have the best measures in place to save as many lives in Western Australia as possible.
Doses, why hasn't WA brought forward to 3 months the interval between 3 doses every other state?
Look, we're currently considering that, but our clinics are currently very full and doctors and nurses are very full. Western Australia, contrary to other states, the last advice I received is the bulk of the vaccination are actually taking place in state clinics. So we're doing most of the vaccination across the state. In other states, it's more your GPs and pharmacies are doing most of the vaccination. But we've got to make sure that we get children, third doses, and those people who are still, coming up to their mandate. You've got to remember the mandate kicks in on the 31st of January. Still lots of people getting their second doses who need the opportunity to get that done as well.
If you're unsuccessful in the federal court this afternoon and have to appear in Sydney on the 31st, will you isolate for 14 days upon return?
Yes.
Aren't members of Parliament, though, exempt from those provisions?
I think what can happen is you can leave isolation, wear a mask, all those sorts of things, go to various places, but I wouldn't do that.
Year 3s are only 8 years old, I believe. Do you think they'll be capable of complying with the mask-wearing mandates in schools if it comes to that?
I think other states are doing this, and obviously it's an issue. Having had 3 kids, I understand the difficulties with getting young kids to wear masks and comply with those sorts of things. But we're not doing it up front. We'll wait and see how it works over East, and we'll take health advice on when it's necessary to do it.
When will West Australians learn what the rules will be for close contacts and isolation after the border comes down?
Well, the plan is that we will identify the close contact and isolation rules on Friday at the State Disaster Council. Sometime after that, we'll make an announcement.
Have you told the mining industry anything yet about that side of it?
I had a good discussion with them yesterday, and that obviously guides some of our considerations because they're an important part of the West Australian economy, and we want to make sure they operate effectively and get their specialists in who they need and that sort of thing in a very safe way. So we had good consultations yesterday. It was a very good meeting, went for quite a while with lots of senior people from the mining industry, and that'll factor into our considerations in a safe way for the sorts of rules we'll develop on Friday.
Did they specifically say a 7-day isolation period would be much more preferable?
Look, there was lots of views around that, but obviously what happens, there's various rules over East. We'll just refine them on Friday as best we can for the West Australian circumstances, but they'll be broadly consistent with the national rules. But I just remind you all, you bring them in too early, you're going to enhance community spread whilst we're trying to get our vaccination levels up. So there's nothing sinister going on here. All we're trying to do is make sure we save as many lives as possible and we save as many jobs as possible at the same time.
Testing numbers have been really low in recent days despite pleas from government. Are people not listening to government anymore? Have you lost the trust of the people?
There was 9,831 tests yesterday, which was double the testing numbers of the day before. So that's a good sign. I just urge people to go out and get tested and also use your QR codes. So when you go to a cafe or a supermarket, you go to a shop, please use the QR codes because that is essential for us contact tracing should one of those sites be an exposure site.
Premier, it's still the intention that if someone comes internationally, say into Sydney, they don't have to quarantine there for 2 weeks. They can come straight to WA and then quarantine here. That's still the case, isn't it?
Yep.
I'll just check that for Gareth.
Why did Victoria, New South Wales and the Commonwealth Government all sign deals for rapid antigen tests with a per-day supplier before the WA government?
Look, the advice I have on that is that a company that you've identified, approached Path West this month, as in January of this year. Path West went back and said, can you provide us with a sample kit so we can verify its effectiveness and how it works? And we never received any contact back from the company.
It may have been mentioned, but are there plans to roll out rapid antigen tests for students and staff when you do have them?
So the Minister went over that at length. The reality is that we're going to watch what happens over east. So various states are doing various things. So New South Wales and Victoria is doing what's called surveillance testing. You've got to remember they have tens of thousands of cases a day, hundreds of thousands of cases in the community. So they're doing surveillance testing in which they give 2 tests to each child and each staff member per week for a month. Now, I think it's certainly high school, it might even be primary school in New South Wales, might be in Victoria as well. And what they're doing is that's called a surveillance testing regime. But they have tens of thousands of cases in the community, and they've also had lockdowns in which kids haven't gone to school for months on end. So they want to create an environment in which parents are confident to send their kids to school. Our environment, of course, is very different. Parents can have utmost confidence in sending their children to school with all of the measures we've announced and put in place. Other states, like Queensland, they've delayed the return of school for 2 weeks. South Australia is returning certain cohorts, certain years to school, and other years of schooling are waiting a week or 2 weeks or so. So various states are doing various things. Now, they all have thousands of cases a day. We don't. We have 15 local cases today, of which 2 are unidentified. So if I can finish. So our regime is based upon the circumstances we face. It's based upon cleaning, ventilation, vaccination, and mask wearing. And it's very safe for parents to return their kids to school.
Does WA have enough tests to do it?
Available at schools?
Sorry, Ivan?
Do you believe that rat tests will be available at schools?
I think I just answered that question, but there's no requirement for rat testing to be put into schools at this point in time, but we will monitor how it goes over east, and we'll monitor the Queensland model and the South Australian model, and because we have such incredibly low case numbers compared to the eastern states, parents can have utmost confidence in sending their children to school.
Does
Given
WA have enough
the
tests to do it?
reaction to the Fiona Stanley hospital situation, a mother and daughter go into a hospital and put into the waiting room with all the other families?
Well, it was obviously disappointing. The Minister has spoken to the Chief Executive of the hospital to work out what happened. Obviously, that was not in accordance with protocols. We're contacting all hospitals to make sure they enforce the protocols that are in place.
Given you're trying to source rats from all over the world, why haven't you gone back to this West Australian-based supplier that's sending millions of them to the States?
Well, we did go back to them, and we didn't hear back from them. But obviously, we can go back to them. Again, all I'd say to you is we are currently scheduled to secure 10 million rapid antigen tests by the end of this month, by the 5th of February, certainly, the advice is certainly, and by the end of this month. We're totally scheduled. In total scheduled now to get 105.5 million rapid antigen tests at a cost of $640 million. Our rate of acquisition, if you like, is going to grow, we expect, by 10 million by the end of this month, by the 5th of February. Another 15 million are expected by mid-February, and another 10 million expected by the end of March. So we're growing our rapid antigen test supply very, very quickly.
Is it enough supply, right?
Ask what dates you actually made the very first.
I think, as I said, I think it was in December, but I'll explain all that again to you. So the reason New South Wales, the reason it's different here to the other states, or different to what we originally announced, was the Delta variant. The testing arrangements around the Delta variant was about the fact that PCR testing could manage very well the potentially positive cases. And so we have a whole range of PCR testing clinics out there. The reason PCR testing is preferred is it's more accurate than rapid antigen tests. So we wanted people to get PCR tested. Obviously, the Omicron variant came along. It was in November, second half of November. It was identified in South Africa. The first case in Queensland, I think, was on December 8. Some of the first cases at Sydney Airport were late November, very end of November, sometime there. So we then decided to order rat tests in the first half of December because the Omicron variant spreads far more rapidly than the Delta variant. So it was a response to that. Victoria and other states were in a bit of a different position because they already had mass outbreaks and they had been in lockdown, and they were trying to get kids to school, for instance, in Victoria, because they didn't have kids going to school at all. So it's a very different circumstance to Western Australia. We have a strong expectation of large numbers of rats because we've ordered them, and that will be, as I said, at least 10 million we expect by the 5th of February.
If WA wanted to roll out surveillance testing in WA schools, do we have the supply to do it now?
Look, there's no need to do it now, and you certainly wouldn't use large numbers of rapid antigen tests when you don't need to. So the idea that somehow we roll out rapid antigen tests when we had 15 cases today, 2 of which were unlinked, would be totally and utterly unnecessary.
Why is it so difficult to just provide the data?
As I said, it was in the first half of December.
Is that a purifier there? Is that one of the ones that's
Yes,
going to the school?
we'll have a look at that now.
Thanks very much.
This stuff out of the way and then we can get through this later.
Press conference